Are you suffering from muscle weakness, pain, or even some muscle conditions, or even joint pain? Well, let me tell you, there might be a solution out there for you, and that might be low-dose ozone or high-dose ozone. If you want to learn more, then listen to my podcast on the Healing Wellness Show. Welcome back to the Healing Wellness Show, where we answer patient questions and concerns about their health and wellness. Today, we're actually going to be talking about low-dose ozone IV and EBOO therapy, which is the high dose. This cutting-edge treatment is making waves in the regenerative medicine world because people are using it for detox, immune support, just overall health. I'm Dr. Kareem with the Healing Wellness Show, sponsored by Iowa Wellness Center, and I want to welcome you to the show. So we're going to answer some questions here that are coming up from patients. The first thing that we've got here is, what is low-dose ozone IV and how does it work? Well, low dose, right now you're breathing oxygen, it's O2. Ozone is O3. It's 10 times better than regular oxygen. So there's lots of benefits out of that. So the way that low dose works is we take your blood out into a bag. It's that darkish reddish color. We then mix it with ozone, gets really bright red. And that just means that your blood is heavily oxygenated. We then put that back in your bloodstream, and that's where it starts to circulate through the body, and that's where it starts to attach to the worst areas in your body and start to heal it. Now, what is that used for? Well, lots of things. We use it with many, many conditions or just wellness in general. And that is to increase the oxygen, improve circulation, decreases inflammation, fights infection, bacteria, viruses, and just overall boost the immune system. So another question that just popped up, which kind of based on, is what does low-dose ozone IV therapy benefit? And that's really boosting immune function, kind of like I said, helps fight infections, chronic Lyme disease. We've used that multiple times, and actually we've cleared a lot of Lymes with just doing ozone. Viral infections. So during COVID time, we had lots of patients that had lingering symptoms of COVID that didn't go away. And we typically did one or two of the low dose, and that typically took care of it. But flu season is popular, just any illnesses, bacteria. Mold toxicity is another big one that we see quite a bit and try and clear. Does reduce inflammation. So we have a lot of disorders like arthritis or rheumatoid arthritis, chronic pain in the joints. Another one that's huge is improving circulation and oxygenation. So we have a lot of athletes that will come and do ozone just to, boost their blood supply for it to go back to the muscle and heal it. Because when you're working out, you're getting those micro tears. So it helps with recovery that way. And then detox. Heavy toxins, heavy metals, oxidative stress. It helps with a lot of that. And then as wellness, the anti-aging world that everyone wants, to look younger, helps stimulate collagen production, cellular repair as well. Another question we've got here is, who would you recommend low-dose IV therapy for? Like I said, it's for anybody and everybody. It doesn't hurt. It's just basically putting high dose of oxygen in your bloodstream in order for it to help your system. There's different ways of putting that in, and we'll answer that. That is another question that's popping up here. But like I said, we're using that with Lyme disease, with heart issues, whether high blood pressure, low blood pressure, mold toxicity, just overall wellness and immune support. So how does the ozone IV differ from IV therapy, which we've discussed last week? We use them hand on hand. Like a lot of times we'll have patients that come in and do both at the same time. We'll do the ozone first to put oxygen in their blood, and then we'll infuse them with vitamin IV. So they're both beneficial, except, the ozone, we're putting that high dose of oxygen. Okay, so we've got a bunch of questions on the EBOO here. So let's answer some EBOO questions. So what makes EBOO therapy more powerful than the ozone IV? So the differences between the low dose and the EBOO, which is the high dose, is the low dose, we're doing about 60 milliliters or cc's of blood. With the EBOO or the high dose, we're doing 2 liters of blood. Okay. So the equivalent is 1 high dose is equivalent to 10 low doses of ozone. So that's really beneficial with the EBOO. The EBOO here, question is, how is that being done? You know, you can't take 2 liters of blood out of the body at one time. That is correct. We don't do that. So the way that we do the high dose ozone is you get an IV in one arm. It takes it through a little chamber that thins the blood. And at the same time as it taking it through that chamber, it actually cleans the blood out of a lot of toxins. You'll see it in a little container that it takes a lot of the water out, and a lot of it'll be kind of like foamy and a lot of gunk that comes out. And then ozone is introduced to that chamber. So now you're getting a larger surface area of the blood that's absorbing the ozone. And then it actually goes through a UV light, which is for antibacterial, antiviral. And then it goes through your other arm into another vein that puts it back in. So it's kind of like a dialysis machine. It's a closed circuit, and it takes it, puts it back in you. So that's why we don't take 2 liters out at one time. It's just circulating. And that way we're cleaning a lot more blood than just with the low dose. So what conditions, again, I'm getting asked for the EBOO. It's the same thing that we do for the lower dose. With the EBOO, we actually will use more with more chronic conditions. Like we've had kidney disease or liver disease or pancreas disease, or sometimes it's cancer patients. We'll be seeking these treatments because they've read about them. So we'll see a lot of these chronic conditions, but we also have wellness patients or athletes that do it. I do it once a month just for wellness. I don't have any problems, but I love the feeling of it. It takes about an hour and a half to 2 hours to do this procedure, but typically halfway through, you just perk up, you feel more energized, you have a lot more energy, and usually it lasts quite a bit afterwards as well. So I've got a question here. Is ozone therapy and EBOO safe? Yes, they are safe. We've never had any issues. It's basically knowing how to do them. Obviously, with ozone, and that's another question that's popping up, is, hey, I've heard that is toxic and it's not good if you inhale it. That's true. If you inhale it, it actually will damage the lungs. We don't have you inhale it. We're actually putting it through the bloodstream. The bloodstream will absorb that oxygen, and that's how it circulates through your body. So there's nothing inhaled. So it is safe. We've never had any issues with it. Someone just asked here, what about some of the side effects? The only one that might occur, but we've never had any of it, and I'll tell you why here, is detox. So you might kind of detox. If someone goes into just doing the high dose right away, you might detox. That's why we don't do that. In our clinic, the protocol is you have to do 3 low-dose ozones before you do a high dose. And that's so that we can avoid that detox. The detox will be, signs of kind of like getting the flu, right? You might have a temperature. Your body's basically overloaded with oxygen. It's trying to heal something in the body. So that's why it might, you get fever, chills, the typical symptoms of detox. But it is safe. We've done it for, the last 8 years, no problems whatsoever. So what can someone expect during a session is a question that popped up here. Well, it's really pretty easy. The low dose takes about 20 to 30 minutes to do. You're typically sitting in a relaxing, comfortable position, just like the IV therapy. And like I said, we take the blood out, put it in the bag, and just let it slowly drip back into your bloodstream. The EBOO, on the other hand, like I said, it's a closed loop. So that could take an hour and a half to 2 hours, depending on how fast your blood is pulling. And then I've got here, can you share a patient success story with us? Yeah, I've got lots of them. I mean, we've got plenty of the cancer patients that come in and seek it. Typically, cancer patients that seek it, they're the worst of the worst. So that's why they want to do whatever it takes. They typically get scanned every 3 months. So typically when they come and start, we tell them, are you getting scanned or not? And typically they are. So that's where we can see if there is a difference or not. But a lot of times it does shrink that tumor or cancer cell. And we've seen it up to 50% when they come in and do it and then get their scan in 3 months. Cancer cells don't like oxygen. That's basically what we're doing, is we're putting high dose of oxygen in there. Another story is I had this Amish girl. She was, I think, 14 at the time that she came in. Really bad mold toxicity, that she was really tired all the time, couldn't function. She couldn't be in gatherings or anything like that. Always sleeping. Didn't feel the best. She started doing the ozone, low dose ozone, and then we switched her up to the EBOO. And I would say within a month and a half, she perked up. Within 2 months, she was able to get to gatherings again. Her biggest thing was going to church on Sunday because it was a huge gathering with everybody, and she couldn't do that before, and now she is. And when she went and got tested to see if she still has mold, it was all gone. So there's lots of stories like that, especially with Lyme disease as well, and other success stories. Another story that we have is during COVID. I mean, during COVID, we had a lot of people that had lingering symptoms of COVID. I had this gentleman, barely can breathe, was wheezing. They put him on an inhaler, came in, seeking anything that he could do. We told him about the ozone. He said, hook me up. We started with the 3 low dose. After really the 3rd one, he was able to breathe. He did use the inhaler less. We started doing the high dose after that. I think after his 2nd high dose, which we did that on a weekly basis in the beginning when someone has it like that. By the 2nd one, he was actually walking by himself, not wheezing. He wasn't using an inhaler anymore. We did 1 more session, and really he was static. He was back to normal, and he was really thankful for finding about us and EBOO. I've got a question here. Someone just asking, hey, how can we book this? Well, you can book it by going to the website. You can click on the website. You can check our treatments there. You can give us a call and follow us on the Healing Wellness Show. Follow us on Facebook, TikTok, YouTube for more content and more information on whether ozone, IV, or anything that we're going to be discussing here in the future. I've got a question that just popped up. How many sessions does someone need before you see results? That is a very hard question to say. I mean, that will depend on each person, each body. It's how it absorbs that oxygen. If you're doing strictly low dose, it could be after, 7 to 10 treatments. If you're doing the high dose, it's typically within that 1st, 2nd treatment that you'll see the results. But everyone is different. If you're really, really sick, then yeah, it's going to take longer. If you're not, then it doesn't take as long. It's typically what we see. I've got a question here about, do you have any specials on it? Yes, we do have specials on the low dose ozone and the high dose. The low dose, if you're going to do a series of those, we'll give you $50 off. The high dose ozone, we typically will give up to $500 off. So just mention those, saying that you heard it on the Healing Wellness Show, and my staff will honor that for you guys. So I got last question here that we'll take is there different ways to use ozone? Yes, there are multiple ways of using ozone. You can ozonate water and drink it, which some people do that at home. You can do rectal ozone. You could do ear ozone, which we actually do at the clinic. We do use the ear ozone for headaches, chronic sinus, just anything head related. We'll use that for. We've had someone just recently come in with tongue sores and stuff like that, where we had them do the ozone water, swish it and drink it. That cleared it up for them pretty quick. So there's lots of benefits of ozone. We also do it for infections. We have a lot of diabetic patients that come in with sores that don't heal. We can do a bag that we put, say they've got it on their hand, we can put a bag, diffuse ozone in there, and actually that starts to heal that wound. So wounds that aren't healing or closing up, we can use ozone with that. So there's lots of different ways of using ozone. These are just a few ways that we use in the clinic, except for the rectal one, we don't use that. We do the IV, which is more beneficial. A question just popped up after discussing that is it beneficial to do it one way than the other, or are they all the same? Yes, it's again, coming back to that absorption rate. Everything goes back to the blood, right? So the best absorption rate will be the IV ozone. It wouldn't be the drinking, because again, that's going through your digestive, breaking a lot of it down. The rectal, yes, you are absorbing a little bit more, but yeah, the best way will be the IV. So if you have not done ozone IV, I would highly recommend trying it out, especially the low dose. You can start with that. But there are lots of benefits of Ozone IV. Just like I said, the brighter your blood is, the more oxygenated it is, and that's where all the benefits come in. A lot of times, like when I first started, before I started Ozone, my blood was that darkish reddish color. You draw my blood right now, it's actually super bright red. And that's because I do that EBOO every month. So doing Ozone IV is very beneficial. We have patients that come in and do it once a week and once every 2 weeks or once a month. That is what I would recommend. I mean, if I do it, that's why I recommend it for everybody else. We don't introduce anything that I wouldn't have tried or done just for wellness sake, but that is very beneficial for anybody, everybody. We have from kids to my oldest that's doing IV EBOO right now is 96. So all ages, it's really beneficial. Is EBOO voodoo? And why do you need it? No, EBOO, which stands for Extracorporeal Blood Oxygenation and Ozonation. It's basically putting high dose of oxygen in your blood. Best way to explain it is think of it as it's doping. So remember Lance Armstrong used to dope? It's kind of like doping. So you're getting high doses of oxygen so that your body can perform and it can heal any diseases, viruses, bacteria in your blood, in your system, organs, anything. So got a question here. How does EBOO or Ozone help with neuropathy? We use EBOO and Ozone with every neuropathy patient. It is in my protocol that we use Ozone IV to help heal the nerves. Again, we want to put high dose of oxygen in the body because when you have neuropathy, your nerves are basically diminishing. They don't have the proper oxygen or nutrients going to that nerve, and that's why it's diminishing, it's dying. Okay? So in order to heal it, we need, again, when I talked about neuropathy, the 3 components. We need nerve re-education, circulation, and getting rid of inflammation. Inflammation likes the joints and it attacks the nerves. So how do we get rid of inflammation? Well, high dose oxygen. Circulation, high dose oxygen. Get the nerves to function again? Well, you need the oxygen nutrients in order for it to fire again. So oxygen, oxygen, oxygen. So EBOO, high dose, low dose ozone. So what does EBOO or low dose ozone do for muscle pain or muscle conditions or joint pain? Well, again, that comes back again to inflammation. You've got built up inflammation in the muscles or in the joint. We need to get rid of it. The body isn't coping, so that's why it's not getting rid of that inflammation. So what we need is high dose oxygen, and that's what we're doing with Ozone IV or EBOO, which is high dose ozone. So basically it goes into the bloodstream. It starts to attach into the worst areas in the body, which need oxygen. And that way starts what we call back in biology class, the Krebs cycle, which is the energy factor to start the cells working again and start that healing process in those cells.